In medical, there are many topics which are so fantastic. Blood pressure regulation is one of such topic. That by the end of this topic, you'll feel like saluting the God. That is such a beautiful mechanism. By the way, some emails were received. One, the difference between core pulmonale and P pulmonale. Very simply speaking, core pulmonale is right heart failure. So though its name is like core pulmonale, but this is the right heart failure which is normally due to afterload, correct? So let's draw it very quickly. So here it is. This is the right atrium, this is the right ventricle, and over here the lungs are there. So when the blood will be going into the lungs, and if there is increased pulmonary pressure, right, that is what is called as the pulmonary hypertension. So that will lead to increase in the back pressure. That back pressure will lead to failure of the right ventricle, and that is what is called as the core pulmonale. Now there can be several reasons of increased pulmonary pressure or the pulmonary hypertension. There can be congestion, there can be everything, congenital, traumatic, inflammatory, neoplastic, and miscellaneous. So there might be pulmonary atresia, right? The lungs itself, they might be smaller, right, or compressed, or it could be, say, some injury, maybe some clot, so various is some infection, some malignancy, whatever the thing, but the blood which is going into the lungs, right, if that is obstructed, that is what will lead to back pressure, and that is called as the core pulmonary. Yes, for that, you need to diagnose it with the help of X-ray chest. Well, if you want to diagnose it with ECG, it is not the direct, because it won't be actually showing you the condition of the lungs, ECG. But in ECG, you can see that there would be the right ventricular hypertrophy. And whenever there is right ventricular hypertrophy, we can really say that from V1 to V6, right? So because right side, this is the right side of the heart, right? So that would be more near to the V1. So that would be all the rising, that is R waves, they will be taller, right, into the V1. Rest, you know about how to see that. Regarding the P pulmonale is when there is a right atrial enlargement. So we have seen that this is the P wave which is formed by, if you divide it into two parts, this is formed by the right atrium and this is by the left atrium. So when we get something like this, so this is what is called as the P pulmonale, right, which is the indication of a right atrial enlargement. This was one of the questions. The second question, which was very interesting, in some of the institutes or in some of the colleges, when it is said that USMLE, it is divided into two parts, the step 1 and the step 2. Right? Step 2, previously, there were again two parts. That was the CK and CL, right? Clinical knowledge and clinical learning, that is implementation of it. Now there is only one part, so we don't have to really discuss about the second part. This first part, clinical knowledge, and then there is a step 3. Step 3, which is purely practical, and you have to appear for this in US after completion of your step 1 and step 2. Now the point is, in some of the colleges, when it is said that you can appear for step 1 after first year, well, not possible. I would never ever suggest. Two main reasons of it. One, you are learning right now physiology. Physiology is like a foundation. It is like a base. Step 1 is comprising of almost 70%. The heavyweights are physiology, pharmacology, and pathology. These three are heavyweights. Right? Pharmacology and pathology, in order to understand that, first your physiology should be super strong, and then we'll be diving into the pathology, right? Because pathology is nothing but it is a variation of the physiology. Today we'll be learning blood pressure, right? One of the most fantastic systems. But next time, parallelly, I'll be teaching you the hypertension. What can really go wrong in the blood pressure and what are the after effects? But if you understood today's session properly, it would be extremely interesting next time when you'll be learning the pathology part of it. Because both the things, they go hand in hand. But what about the pharmacology? Well, we won't be discussing the pharmacology at this point of time. The reason? Pharmacology itself is a very mammoth topic, huge topic. Right? So that's the reason that anatomy, physiology, and biochemistry, they are in part one, part E, that is the first year. And in the second year, there is pharmac and patho. So that normal pattern is that by the time when you complete your second year of MBBS, this is your first MBBS, this is your second MBBS. When you complete this, and if you have completed this with very proper understanding, so then yes, this would be the correct time when you can appear for step 1 of USMLE. Now there are some shortcuts. Trust me, there are some shortcuts. Shortcuts are like question pools and so many other things. Right? So even without understanding, say, people do comment like that, say for example, ECG. And in ECG, I told you there is one of the super interesting topic, that is what is called as the arrhythmia. When you'll be learning arrhythmia, you'll feel like as if you're learning electronics, right? Signals, they are going from this wire to this wire and what really would happen. But the shortcut is, say in step 1 USMLE, there are about 10 questions. 10 questions of ECG. You learn those 10 questions. I mean, I won't say learn. You cram those 10 questions. And ECG part is through. But how would you really feel when in real life it comes? Or it comes into your step 2. Right? And trust me, it happens like once. Means it's not like your fault, but it is a normal human mentality. Same, you, me, all are same. Something if we have completed, then we feel like yes, some of the topics are left out, but we'll see ab aage ki soch. Go for the next thing, right? And these things, they remain as our weak point forever. I do have guitar at my place. It was my dream, and it is lying over there in the drawing room, right? Since 10, almost 10, right? 9 years. 9 years. It was my dream. Le to aaye, but then there was one after the other, something happened. Right? And well, it is, I still regret that why I have not learned it. It happens. So I won't suggest appearing for step 1 over here. Means doing 1,000 questions, question bank and everything, all those, there are several shortcuts, but if you really ask me, I would never suggest. Step 2, it is the clinical knowledge. Yes, it has to be completed. It has to be, one can appear for step 2 after you complete everything. Everything is all the way you complete your MBBS. But immediately, target should be immediately after completion of your MBBS, and during the internship, people appear for, they utilize their time for appearance of this step 2. Once you have done these two, so then this practical part, that is relatively much easier. If your understanding is good, if you are sailing through all the exams clearly, don't worry much. So these were the two main important questions which I wanted to address. Regarding the books, there were several emails regarding the e-books. Which one is better? Will we be having USML lecture from the start when we reach our university? Devansh, this varies from university to university. Many of the universities, they see, truly speaking, I'm again clarifying this. USMLE is not the exam which is from outer space. What you are learning, when you say you are learning anatomy, you are learning physiology, right? So they all are part of USMLE only. But will they be asking you direct question that, okay, what is the, say, root value of axillary nerve, right? No, such questions won't occur. They'll be asking you some practical things in a way that when if you answer that question, it automatically shows that your understanding about the nervous system or the brachial plexus is good. So my suggestion is, for 1 year, don't even think about USMLE. Make your foundation very strong, very strong. You are not appearing for anything overnight. When it will come to USMLE, and actual the training which I gave, it is like a 6-month training. Within 6 months, yes, we revise each and everything, but remember, it goes at a very high pace. Right now, what we'll be understanding today, right, as we'll be discussing the hypertension, we'll be going for all the details. Yes, the lecture. Say, for example, the question which you asked is that aren't your lectures and notes enough for physiology? We have to read Guyton and Guyton or Samuel also. Well, I would suggest, say when we'll be talking about blood pressure, right? You'll find that almost the entire concept, if it is crisp clear now, so then there won't be any problem in the exam. But why I would say yes, you can read it, because it happens. Like, say, we have got limited time, right? I try to finish the topic which we have picked up in as much detail as possible. Sorry, but some of the topics, say for example in anatomy on YouTube, I've tried to cover the dissection part, but not everything. But not everything which is there. So yes, you have to go back to the books for the completion. You to attend your online lecture to my university lecture time. I can understand, and that's why, see, regarding this, I've just received 6 emails, just 6 emails about the timing part. And if I combine these 6 emails, so then it is like we have to stop the lecture, because somewhere means there is no convenient time which is common to everyone. So that's why I have not made any changes in our timings. So I try that, say, if not much. That's why you must have noticed that I have started writing in detail. So even if you get the PDF, you don't have much of the problem. Right. We got a call from Vishwa that, are you going to attend a lectures? I mean, I'm not aware of it. Must be something administrative. Anyway, chalo. So regarding the ebooks, quickly we take it and then we start with our today's topic. Whether ebooks are good or physical books are good. Physical books. I would say ebooks, they are excellent because they give you wide range. Plus, in your iPad or in your laptop, you can have thousands of books. Important part, that in ebooks, even if some books are very expensive, these books you get it almost at no cost. So even if you read just 1 or 2 topics from an ebook, it is fine. You have learned something. Physical books, they are good, and only those books should be taken which are important from the academic point of view. And once you have got the physical book, there should not be any mercy on it. If this is the book, don't keep it neat and clean. There are spaces, right? Write your own notes, write your markings, right? Mark it, something which is important, right? If you don't, some things which are to be revised at night before you go to sleep. So yes, right? Make a special mark so that you utilize it properly. All right. So let's start with our today's topic, and that today's topic is blood pressure. Right? Blood pressure. And yes, we are talking about the systemic blood pressure. So you must be knowing from our past sessions that there are 2 types of blood pressure: systemic blood pressure and the pulmonary blood pressure. Right? Pulmonary blood pressure, which is a very small circuit, which starts with the right atrium to right ventricle to lungs, and it ends over there into the left atrium, which is a small circuit. Right? In this small circuit, there is only one organ, that is lungs are involved, and that's it. Right? So this is a low pressure system. What we are dealing with now today is the systemic blood pressure, which is a high pressure system. Right? So whenever we say blood pressure, right, any pressure, blood pressure, pressure is, this is the vessel. This is the vessel. What is the pressure generated onto the walls by the content which are inside? So obviously, in our case, this content would be the blood. So amount of pressure exerted on the walls by the blood, that is what is called as the blood pressure. Right? That is amount of pressure on walls. Pressure on walls. Time to time, as we'll be proceeding with the topic, you'll find that we'll keep on discussing, we'll keep on comparing it with the traffic. Right? If the road is narrow, if the road is wide, so then what would happen to those cars? So that would be our method. So in case of blood pressure, we have got systolic blood pressure and the diastolic blood pressure. Systolic, when the heart contracts, right? Heart contracts. When the heart contracts, so that means we are talking about left ventricle. That will be generating maximum power, and this is the systolic blood pressure, right? So this is the systemic, so that's where left ventricle contracts. And this is diastolic when it dilates. So can I say this is the filling phase, right? It is the filling phase, correct? Can you share the recording? No, I'm not recording any of the lecture. Hardly I have recorded one or two lectures, but I think someone from administration, they are recording the lectures, right? I'll just confirm it, because many of the students, they say that they have got access to my old lectures. But anyway, I'll just confirm and get it. So coming back to this is the blood pressure, systolic and diastolic, and the diastolic is D for the dilates, and that is the filling phase. One important mean arterial pressure, MAP, that is, when we talked about it, that is the systolic, right? Systolic divided by 3 plus 2/3 of the diastolic phase, diastolic blood pressure. Right? Why so? Because the amount of time spent into the entire cardiac cycle, 1 unit. So systole is faster, diastole is longer. So it is like 1/3 phase is for systole, and the 2/3 phase is for diastole. Right? So when the blood pressure is 120/90, so we have to calculate it like 120. This is systolic divided by 3 plus 90, which is multiplied by 2/3, 120/80. Right? Normal. Let's keep a normal blood pressure, 120/80. So that's why this will become 40, and this will become 53, right? So it becomes 93. So this is the mean arterial pressure. When we talk about the pulse pressure, right? Pulse pressure is systolic blood pressure minus diastolic blood pressure. All these three things, right? One is the normal blood pressure, second is the mean arterial pressure, and third is the pulse pressure. These three will be used extensively when we'll be discussing the pathology, right? The pathology, that is when we'll be discussing the hypertension. You need to know it very well, because even in your surroundings, you'll find so many people having high blood pressure, and then they take it very casually. Right? Okay, so let's start with the blood pressure. Right? Blood pressure. So in blood pressure, we want to learn the regulation of blood pressure, how it gets regulated, how it is automatically controlled. Say when you are in clinic, right? You measure the blood pressure of a person, and if it turns out to be, let's say, 150/96, and you will jump, start taking antihypertensives. No, that would be a wrong thing. Technically speaking, before starting any of the antihypertensive therapy, right, any of the blood pressure drugs, simply speaking, if you want to give any of the blood pressure drug, you have to take twice. You have to take your measurement, blood pressure measurement twice, 2 times you have to measure. And in both the times, if it is high, so then you can think of that this is a patient of blood pressure. Many times I tell, now see BP instruments, they are very cheap, right? Someone can afford even at their home. So normally what I say is, as this will give you very much clarity. Not only that, it will save many of the patients from unnecessary drugs. I was just watching one news. I mean, you feel like, where are the ethics? With how much cap? I'll let you know. And just a good question. How much cap? It's 2 times, but with how much cap? Truly speaking, 10 minutes. At least 10 minutes. So let the patient sit comfortably and then you take this. The incidents which I was watching, there was a doctor in Michigan called Dr. Fata, and he diagnosed 550 cases, 553 cases of cancer. He diagnosed that that particular person has got cancer, and they were given all sorts of chemotherapy, radiotherapy, right? CT, RT, everything was given, right? These patients, they were not having anything, they were normal. This doctor is now in prison, and yesterday Quota gave him 45 years of jail. But many of the patients, they were like subjected to chemotherapies for more than 20 sessions. Why? Because he diagnosed that patient has got cancer, and they were all completely normal patients. He was doing it for money. He earned $17 million from it. $17 million for money. 553 patients, right? Their life was at stake. Man, and you know, chemotherapy, that's brutal. And chemotherapy, if you really see the patient of chemotherapy, they become like bones because muscle mass is lost, right? Hairs, they go away. Their skin, that becomes so bad. It is like a narc. So, and imagine the trauma, mental trauma. Anyway, what to say? Similar thing happened even. Head cooling cap works for chemo. Yeah, it works. It is good. Acha. I just take it on the next page. Because there was some Ayushman card, right? Pradhan Mantri Ayushman card. One of the hospital misused it, and they showed more than 40 cases that they are having severe blockage and angiography, angioplasty, and open heart, and everything was done. Here also more than 100 cases, even more than 100, cases were recorded. Now those doctors, they are behind the bars. I always say one thing, and do remember it. Do your best. Do your best. And you might feel like, but at one stage of your life, you would say that the money is just a number. It's just a number. After one amount, right, you are not going to use it. Many of my batchmates, right, those batchmates, if you see, they are having lavish, beautiful cars. It's costing very high. But, and they even say that, yaar, tu abhi bhi 12 saal purani Scorpio use karta hai. Yes, because in my life, the first one was Paleo Sports. That was in year 2000. And in 2012, I got my second car, and that is Scorpio. That's it. But very happy with it. Why to Durgesh, there is no limit. Ruchita, what you said is, I took your name deliberately because what you wrote is so good. In fact, this is the sentence which is written in my room also. Don't be behind earning, be behind learning. Very true. Very true. So, chalo, let's talk about now the blood pressure. Right? The blood pressure. So, in blood pressure, for the blood pressure regulation, there are two systems. There are two systems. Because why we said that do bar blood pressure? Right? We take one time and it is enough? No, not really. Because then if we take it only once, so we might be doing something wrong to the patient. Right? In blood pressure, there is what is called as the diurnal variation. Diurnal variation is during the entire day. If you take your blood pressure, you'll find that sometimes you are having high blood pressure, sometimes you are having low blood pressure. This 120/80, so it is a very ideal thing. So if your blood pressure is 130/82, so don't be alarmed. Kare baap re, kya hoga? Kuch nahi. You might have taken a cup of coffee. या फिर right now I'm on second floor, तो दौड़ते दौड़ते आप second floor तक आए. Yes, possible, right? Because when the cardiac output increases, so the amount of thrust with which the aorta is pushing the left ventricle has pushed the blood into the aorta, that is very high, and you measure the blood pressure over here. So this axillary artery, as said, it is coming from aorta only, so that is also getting the thrust. That means it is generating more power, more pressure onto the walls, and the barometer shows that yes, blood pressure is high. You sit for 5 minutes, 7 minutes, 10 minutes comfortably, and you'll find that it has dropped. Right? So this is diurnal variation. It's something which is varying every day. The way your temperature varies, right? That's why when you go to sleep, you'll find that temperature dips. When you sleep, there is something wonderful thing, what is called as the resting heart rate. Resting heart rate. So if your resting heart rate is less, so that is your actual fitness. Right? Because when you are comfortable, so then heart goes to what level? So because it goes to that level and over there it is beating, so that is giving enough blood supply to the entire body. Muscles not involved because muscles are not working. That is what is really, if you need to try to drop this resting heart rate. So that will be one of the very important parameters. Okay, so that's the reason for blood pressure regulation. One, what is called as the fast acting, and second will be the slow acting, something which is taking analysis, synthesis of so many chemicals, etc. But it is important because it is handling the entire body. Right? So let's start with the fast acting first, something which is instant. But this thing is short term. Right? This is short term. It affects, it makes the change, and then sits silently. Right? So here it is for fast acting. Slow acting will take. Starting with fast acting. So for fast acting, you know the aortic arch. Right? Now do you know it so well. You know carotid sinus. Carotid sinus, nothing but carotid artery, and there is a bulb. Right? There is bulb. Bulb means this is the artery, right? So but it is dilated at one point, which is called as the carotid bulb. So this carotid sinus and aortic arch, these are the areas which will be having some very specific receptors. Right? They are called as the mechanoreceptors. For receptors, we always write like this, right? Mechanoreceptors. So these are the mechanoreceptors. Right now I'll write full, so that there is no confusion. Mechanoreceptors. So they are handling mechanical things. One of the thing is, that is the pressure. So they are also known as baroreceptors. That's the baroreceptor. Baro means pressure. Right? So this thing is neurally mediated reflex. When we say neurally mediated reflex, means this is where the nervous system will come into picture. And it will side effects of high and low. it will come. It will come. The side effects of high blood pressure and low blood pressure, that is what we'll discuss when we'll be discussing the hypertension next time, right? That is the topic for next time. And in hypertension, there are two types. We'll be discussing both the things, the primary hypertension and the secondary hypertension. And in this, we'll be going into the detail of what's called as the malignant hypertension, or what is called as the hypertension urgency, right? All those things we'll see. And we'll see it in good detail. Because taking blood pressure, the moment you are into medical college, you are a doctor. And if someone's blood pressure is high, it should ring a bell into your head that now what should I do? What advice should I give? Right? You might not be giving the medicine straight away, but at least you should be able to give some guidance. So, bearing the pharmacology part, you will be learning everything. And pharmacology when it will come, will learn. So, baroreceptors. So, baroreceptors means pressure. So, these receptors, you can say, these are the cells. If there is pharmacology is giving medicine, that's right. Pharmacology is giving medicine, drug. True. So, this baroreceptors, they are such that when there is increased pressure, so they will stretch bars. When they stretch, they send a signal. So here is, now let's say blood pressure increases, right? Blood pressure increase, so what will happen to these baroreceptors? They'll be stretched. So there would be increased baroreceptor activity. Baroreceptor activity. Now what we will do? These are receptors. Receptors means they will sense. Say for example, touch. So if someone touches, immediately it is a receptor. It will run and it will go all the way into my head, and that someone is touched. Right? If someone is pierced, so it is a pain receptor. So then the pain sensation will come. If something is hot, something is cold, there are specific tracks, right, through which the message will be sent. Basically, it is sending that feel, right? So these are called as the afferent impulses. So these are the afferent impulses which will start going up, right? This thing will reach all the way to medulla. So when we say that this is our brain, right? This is the midbrain, pons, medulla, right? And then the spinal cord, right? So it is the medulla. Full name, medulla oblongata, right? But because it is oblong shape, so medulla oblongata. This is where there is a center, and there is a center, so it receives that, right? And it goes over here, and it would stimulate, because blood pressure has increased. Right? Blood pressure has increased. We need to decrease it, right? So this will lead to increased parasympathetic nervous system. So parasympathetic nervous system, when it is stimulated, so it will do what? It will go to SA node. It will go at two places. It will go to SA node, and it will tell the SA node to beta shant, right? Don't be too excited. So it will say beat slow, because blood pressure is high. And second, this will go to blood vessels, and it will say dilate. So they are like vasodilator. So now when the vessels are dilated, so that is like, instead of that small rasta, now there is a big highway. So traffic reduced. The amount of pressure onto the walls where it was so high, so that is now decreased, and things are happy. Correct. At the same time, it will also say to the sympathetic system, cool down. So decrease sympathetic activity. Our body is a wonderful balance of sympathetic and parasympathetic. Right? always remember, sympathetic is our default system. So to remain cool, that is our default system. Right? That's why even when we'll be learning the forensic medicine, and in that forensic medicine, I don't know whether it will come in your course or not, but say IPC, Indian Penal Code, right? In which when we learn the murders, so in murders, when it is said that this is the murder done with absolutely a cold-blooded murder, such person, this means this has been done with complete coolness, right, with total understanding. Person was not at all in anger against the second murder, which has been done out of emotional rage, right? Just gusse mein maar diya. Penalty for this cold-blooded murder is more. That's why it said that if you don't get angry, then you are much dangerous as compared to someone who gets angry and keeps on shouting. Right? So definitely always be dangerous. So this was the slow, fast acting system, right? Because this whole thing acts within seconds. SA node and the vessel vasodilation, that's pretty fast. And the reverse of whole thing, similarly, if the blood pressure is decreased, so what would happen? Right? If the blood pressure is decreased, so if the blood pressure is decreased, so there'll be no stretch, so there would be decreased barometric activity. So there would be decrease in the afferent pulse. So what medulla would think, why no one is speaking? If no one is speaking, that means the pressure has decreased. If the pressure has decreased, so it will say parasympathetic activity. Now you remain silent and sympathetic would trigger, and then that would lead to increase in blood pressure, because it will tell SA node, fatafat, send the signals fast, so that heart starts beating faster. At the same time, there will be vasodilation effect that will be decreased. So the vessels will be constricted, so that will lead to vasoconstriction. So increased blood pressure is because of increased SA node activity, correct? SA node activity plus the vasoconstriction. Right? Vessels would constrict. So this is the fast acting activity. It acts within few seconds and it works. But now what we are about to learn is the slow system, which is vital. Because this slow system is actually controlling multiple systems of the body. So here it is, the slow regulators. But when we say slow regulators, by no way you can underestimate them, because they play a major role. Right? So here is the entire story. This story will start with kidney. It will involve liver. It will involve lungs. It will involve brain. It will involve adrenal cortex. Right? Yes. And the blood vessels and heart, and they are all okay. But these are the 4-5 organs, and see how wonderfully they interact with each other. Right? But if you have understood this now, next half an hour, if you have understood this, and if you revise it and do write it at least 5 times in next 3 days. Next 3 days. Normally, I don't say this much, but for this, I would really emphasize on this. Revise it, because it happens. Bhul jate hain kabhi. But if you remember this, you'll find that pharmacology is so must, right? Everything would be so crisp and easy. So here it is. We start with kidney. Right? Our patient, or let's keep this is for us, right? I have not consumed water and I am dehydrated. For some reason, there is decreased renal blood flow. Why my kidneys should be getting less blood flow? Because I'm running. If I'm running, then blood is going towards my muscles. That blood is going towards muscles. So kidneys, they are getting less. And the third thing is sympathetic activity. Sympathetic activity, sympathetic stimulation. Right? Kutta piche pada hua hai, right? Went for the run in the morning, kutta piche pada, and now there is tension. Right? So these are the three conditions. These three conditions will lead to, in the kidneys, if we zoom into the kidneys, right, in kidney there is nephron, right, which is like a unit. In nephron, there is one area which is called as the Bowman's capsule, correct? Bowman's capsule. Bowman's capsule. Because it is in Bowman's capsule, the blood vessels, they will be going in. They are called as the afferent blood vessels. Afferent blood vessels there. No problem. So these are the afferent blood vessels which are coming. They are wide, and then so let's draw them slightly wide, right? And then there are efferent blood vessels. So there is tuft of capillaries, and then there are efferent blood vessels which are a bit narrow. So automatically there would be the pressure generated inside it, and due to that pressure, the water will be squeezed, electrolytes will be squeezed, and they will be going into this circulation, right? Into the further tubes. We'll see about it. You know about this. So there is, I'm just drawing it. There is proximal convoluted tubule, distal convoluted tubule, and there is collecting duct, right? Proximal convoluted tubule, distal convoluted tubule, collecting duct, and this thing is what is called as a loop of Henle, right? Loop of Henle. All the games, they are occurring over here only, and we have to remember just this part. So here comes our first area of interest, and it is this area. This area. There are specific type of cells over here which are called as the juxtaglomerular complex, right? They are called as this thing is called as juxtaglomerulus complex. Right? On top of it, there is macula densa and everything. But right now we are not going into that detail, right? What are the type of cells of this Bowman's capsule, etc. These are the cells which are just at the junction of afferent and efferent, and at that point, that is over there, these cells are sitting. Now these cells, they're super smart. Right? To be specific, there are granular cells. There are various types of cells into this juxtaglomerular, but these are the granular cells. These granular cells will see that the blood is coming. So it is looking at the afferent. Now, how much blood is coming, right? So that less blood is coming. If the person is dehydrated, less blood would come, right? Or the sympathetic stimulation. Whatever may be the reason, because of these three reasons, juxtaglomerular cells will say, JG cells are also seen in the junction of DCT and efferent vessels. Yes, these are. That's right. They are present over there also. So they release what is called as the renin. And renin, it is put into the circulation, into the blood. Now here is apna liver. Right? That's the liver. Liver, without any hesitation, it keeps on making what is called as the angiotensinogen. Wherever the word comes ogen, right? So this ogen, that means it is not active. This is released into the blood. This is converted into angiotensinogen is converted into angiotensinogen 1, right? It is called as the angiotensinogen 1. This is released in blood. So who converts it? Well, this renin converts it. Right? Renin converts it. So this renin, it converts this angiotensinogen into angiotensin 1. Still, it is ojan, not active. Right? Story continues. This is RAS. Yes, this is RAS. Renin, angiotensin, aldosterone system. Renin, angiotensin, aldosterone system. Right? So all of them will come. So if you know RAS, this is the RAS. Right? But we'll be taking it slightly completely. Okay. So this is angiotensinogen 1. That is now getting converted into angiotensinogen 2. Right? 2. Now this is the angiotensinogen. This is by ACE. ACE is angiotensin converting enzyme. And from where it comes? It comes from lungs. So lungs, they release ACE, and that gets converted into this angiotensin. Now this is where the journey starts. First, this one will act on arterioles. So what are these arterioles? Arterioles are that we have got the artery, it divides into all those small vessels, right? And then they again form, and then they form veins over it. Veins. Right? So these are the veins, and here is the artery. So this is, in other words, this whole thing is called as the capillary bed. Capillary bed. So these arterioles, they will be affected. What they will do is, so if you go into more detail, right, these are having the smooth muscles. They are having the smooth muscles. So there is smooth muscle contraction. So these muscles, they will contract. So in other words, there is arteriolar contraction. When it is arteriolar contraction, so that means there is decrease in the caliber, right? Decrease in the caliber. So thus, they lead to increase in the systemic venous resistance. Correct. When there is increase in the systemic venous resistance, when they contract, so that means the entire pool, the blood would be pushed, because now this is squeezed, so blood would be pushed. When the blood would be pushed, this means, in simple words, it will lead to increase venous return. Because now this is constricted, so the blood will be pushed into the venous system. From venous system, it will go all the way to the right atrium, to right ventricle. Eventually, it will reach to left atrium. Left atrium is filled properly. So basically, this is nothing but what we learned: preload. And whenever the preload, that means when the gun is loaded properly, it will fire better. This is the reason that it will lead to increase in the cardiac output. Right. So this is one of the mechanisms. Remember, our aim for this particular case is, increase blood pressure. Because we have not consumed water, we are dehydrated, right? There is less renal blood flow, so that's why it is necessary that blood pressure is to be increased. Venous return would increase because the capillary bed, this is constricted. Otherwise, the blood is lying into the capillaries. If you remember, I told you last time, before that when you run, if there is no swelling, nothing, so that means your heart is working better. Right? Because otherwise the blood would be pooled. If there is leg edema, if their hands are swollen, so that means blood is pooled over here. So if blood is fixed. So if the blood is pooled over here, so there will be less blood which will be going to the heart. Right? So that's why there would be increased venous return, because all the capillary bed, they have constricted. So that's why the blood is pushed. And this blood will be pushed where? This blood will be pushed into the veins, right? So then from veins all the way to the heart. So this is one first, right? Here is, this is one. Our angiotensin is working big way. Now what it will be doing is, meantime, just that ACE, right, angiotensin converting enzyme, this ACE is also pretty smart. ACE will be converting, and this is the angiotensinogen or angiotensin, right, which is the active component. This is active. This is active. This ACE will also be acting on bradykinin. This is one of the another chemical, and this bradykinin is vasodilator. Right? So he'll go and tell कि just don't work. हम इतनी मेहनत कर रहे हैं, we are trying to increase the blood pressure and you'll dilate the vessels, पूरी मेहनत waste. So that's why bradykinin will be inhibited by the ACE. So when it is inhibited, this vasodilator effect will go away, right? So this is just, I remember that ACE will act over here also. Okay, so let's come back to our angiotensin. Angiotensin will also be acting on brain. It will go to brain. It will act on the brain. Two places, two important places. One, the thirst center. Thirst center. And that center would be stimulated. So obviously, just think it out, right? We are running, and that's why whenever the water comes, yes, below, right? Brain is telling. But basically, the brain has been informed by angiotensin. Have water, right? Second, it will go and it will tell, we'll be learning EDH in full detail, just within few minutes, right? So this is anti-diuretic hormone. Diuresis means loss of water, right? Diuresis means loss of water. So brain is told by angiotensin that save water, right? So that is the motto of anti-diuretic hormone, anti-diuretic, right? So it will say, no, I won't let the water get wasted. Right? Anti-diuretic hormone, it is also called as the vasopressin. Right? As I told you, we'll be talking in detail. Complete cycle, on which receptors it acts, how aquaporin works, all will be covered in just within few minutes. So this is anti-diuretic hormone. This another important one. So this is the brain. The third, angiotensin will go all the way to adrenal cortex, adrenal glands, right? So if this is the kidney, right, the cap on the on the kidney, these are the adrenal glands, and in adrenal gland there is cortex, and then there is medulla. Cortex and medulla, and in cortex there are three parts, right? There are three zones: zona glomerulosa, then zona fasciculata, and zona reticularis. We'll see that, and all of them, they will be releasing something which is very important. Say for example, medulla, it releases catecholamines, right? Catecholamines means what? Catecholamines means nothing but simply apna adrenaline. Noradrenaline, dopamine. So these are the things which are sympathetic stimulator. And GFR, fight or flight. That's right. And this is the area in which we are right now interested. So this will be releasing aldosterone, which is also called as the mineralocorticoids, right? So that is the aldosterone which will be released. Then this is the corticosteroid. So this releases cortisol, which is for the stress, right? Lesser the cortisol, less would be the stress. And then this reticulosa, it will release androgens. So they are the sex hormones, right? So all these things. But right now we are interested in this zona glomerulosa, right? Glomerulosa. So that is what is releasing this aldosterone. This aldosterone, right here. This aldosterone, what it will do. Right now, the function, our aim is increase the blood pressure. And always remember this golden sentence: water follows sodium. Water follows sodium. When we'll be discussing hypertension, at that point, we'll say that you just have those French fries, right? And on those French fries, right, they make it so tasty. But extra, they add extra salt, and that salt is not potassium chloride, that is sodium chloride. So when that sodium, it enters into your body. Now you know it so well. Our extracellular fluid and intracellular fluid, correct? So there is so much of sodium. Now this much sodium, if this much is the sodium, so then in order to neutralize it, what you have to do? You have to pull the water, right? Because only the water can cross semi-permeable membrane. It means wherever the sodium goes, water follows, right? So this is the thing. Water follows sodium. Now, what aldosterone is doing? Aldosterone is telling that because we have to increase the plasma volume, right? So don't let the sodium go waste. Now, from where the sodium is going out? The kidney, right? So kidney is throwing a distal convoluted tubule this is the distal convoluted tubule and the collecting duct, right? DCT and the collecting duct. This is where the sodium would be said ke jao bhai jao, right? And water will also fall. Aldosterone will lead to sodium reabsorption. Chalo, take them back, right? Take them back. But body will say that we need to balance the ions. They will say, okay, let the potassium go. So potassium goes, sodium is reabsorbed. So in simple words, aldosterone, it acts on distal convoluted tubule and it acts on collecting duct, collecting tubules or collecting duct. And what it does, it increases sodium reabsorption. Correct? Because over here, there are the blood vessels. No? There are some blood vessels. So this sodium is taken and put back into the blood. When it is back into the blood, the water will piche because we need to balance the osmolarity. We need to balance the osmolarity. Body balances 140 milliequivalent of sodium very precisely, because if it is up and down even by few numbers, it will make drastic effect on the heart because it is very sensitive. So that number, that sodium, that is the 140 milliequivalent per mole, right? This number is to be very strictly balanced. So this is the sodium which is reabsorbed. When the sodium is more, that means this number will start rising. Immediately water will also come so that it is managed, right? So increase, and that is what we want, because we want to increase our blood pressure. Our blood pressure is going low, right? So we want to increase our blood pressure. So increased sodium reabsorption will lead to increased water reabsorption. When increased water reabsorption, so that will lead to increased plasma volume. Increased plasma volume, that means increased venous return. Cardiac output increased, happy, everything going good, right? At the same time, there would be increased potassium excretion. Potassium would be excreted, right? Now, potassium is extremely necessary. So that's why in some of the cases, right, when we say, okay, have nariyal pineapple, they are having large amount of potassium. So that potassium, when you are fit and fine, so that will keep things under control, right? So much so that it will let the sodium go and potassium will be retained, right? Because it has to balance. Inside we have sodium and outside we have potassium, right? So it is the balance of both. There is always the sodium potassium pump 2:3 ratio that keeps on working, correct? So this is how this works. That is, there is increased water reabsorption, increased plasma volume, so thus there is increase in the blood pressure. So this is how it really works. Now on to what you need to know very properly about antidiuretic hormone, or the ADH, which is also known as the vasopressin, right? Vasopressin. Where is it formed? Right? Now see, in our brain there is hypothalamus. Right? Hypothalamus is like a master gland, right? Master controller, connected to anterior pituitary and the posterior pituitary. So this is made in hypothalamus, cell bodies of hypothalamus, and then it is released. So why should it really release? Because in hypothalamus we have got osmoreceptors, right? These are the osmoreceptors in hypothalamus. So what this hypothalamus does, when there is increase in the plasma osmolarity, what exactly we understand by plasma osmolarity? That means we are running, heavy sweating, water lost, right? But the amount of electrolytes, so they are still there, right? Because relatively they are less. So there is increase in electrolytes. There are more electrolytes, sodium. So there is increase in plasma osmolarity. So osmoreceptors will detect it. Right? When there is decrease in blood volume, from where this message which is coming from those baroreceptors, right? And juxtaglomerular apparatus, that has also triggered, and that has released increase in angiotensin, right? Angiotensin 2. So kidneys are also telling. So now hypothalamus will say, now it's okay, this is the time, release it. Right? So this is the vasopressin, or the antidiuretic hormone that is released. Now what it will do? Once it is released, first thing first, it will again be acting on, its purpose will be increase water reabsorption. Now water was already getting, not water, sodium was getting reabsorbed by the aldosterone, right? Water was as such very much interested ke piche jaye sodium ke. But now we are opening the gates, and this is also acting on DCT, distal convoluted tubule, and the collecting ducts, or the collecting tubules. So same place, right? So here it is, the same place, collecting ducts and the distal convoluted tubule. Now over here, there are specific channels. So our antidiuretic hormone, it acts on V2 receptors. Now what are these V2 receptors? These V2 receptors are very simple. There is a channel called aquaporine channels. These channels are the main channels which will be allowing the water to come out, right? Come out of, because if the water has escaped, so from here to it will go into the urine, right? Then there is no looking back, it will go away. But on top of it, over here, these are the V2 receptors. So when these V2 receptors, when the antidiuretic hormone, right, it will be acting on V2 receptors. So those V2 receptors, they will actually open these aquaporine channels. Right? When these aquaporin-2 channels are open, so that means it will lead to increased water reabsorption. The entire game, it is towards how to save water. Don't let the water go out, right? So somehow get it back. So this is the aquaporin channel, and once the water is reabsorbed, so that will lead to increase plasma volume because it will be going into the blood. That will lead to increase venous return, and now from here to below, what happens, right? There is increase. Finally, there is increase cardiac output. So heart is happy. One more thing happens with what is done by this vasopressin. Take it all the way down here. So antidiuretic hormone, as we were talking about those capillary beds. We were talking about capillary beds. This is also acting on vascular smooth muscles. Now this is slightly better to be understood. It acts on V1 receptors of vascular smooth muscles. Right? And this will lead to, when these muscles are contracted, that will lead to vasoconstrictor. And when there is vasoconstriction, there is a vasoconstrictor. And when there is vasoconstriction, so yes, that will lead to increase venous return. Things go good. But remember the word, in high concentration. In high concentration. So when the person is normal, you'll find that this ADH, antidiuretic hormone of the vasopressin, won't be acting on these vascular smooth muscles as actively as compared to what its main function, main dharma for the water reabsorption. But yes, this is one of the mechanisms, one of the things which you must do, right? So this is one. Yeah. Its importance is when in pharmacology. Sometimes when when the ADH is high, then it is affecting the vasoconstriction also. So we'll see that thing when we'll be discussing the next time hypertension, right? Where you'll see that how it happens, why the alcohol, right? When it is said that the alcohol affects blood pressure, yes, it would. Alcohol affects blood pressure. So we'll see all those things. Okay, so coming back to this aldosterone. Adrenal glands. They are like a mixed gland. I mean, they are endocrine as well as exocrine. Because they say some of the chemicals, right? Some of the chemicals which are released into the blood. Now, let's draw it. That will make things easier. So here is the adrenal gland. So the central portion, it is what is called as the medulla. And this one is called as the cortex. So we are talking about this. If you take a section of this, so then we have got these three sections over here. These are called as the zones or the zona. So glomerulosa, fasciculata, and the reticularis. So over here, this is the aldosterone. And they are called as the mineralocorticoids. Writing this Because when we'll be learning endocrine system, many of the diseases, they will be related to adrenal gland. Many. Because it affects, say for example, if the tumor develops, so that tumor can take any of the layer. So what it is taking, which layer it is taking, accordingly the sign symptoms will be developing. Right? So right now, this is important. Otherwise, say this is cortisol, and it is corticosteroids. This name must have ring some bell into your head. Corticosteroids. This is what people take. Because cortisol, that will improve the muscular function, that will improve the blood supply, right? And it develops the tempo. So this is what people use it. And then these are the androgens. Yes, it is a banned product. You're right, it is a banned product. Right? Then androgens. Androgens, these are the sex hormones. Right? And it is this medulla, that is what we say catecholamines. Catecholamines and the synthesis of catecholamines and how it is affecting, that itself is a giant topic. So adrenaline, noradrenaline, and the dopamine. You must have noticed that all of them, they are the sympathetic stimulant. Correct? So what it will be doing is, talk about aldosterone. So this aldosterone again will be acting on DCT, distal convoluted tubule, and the collecting tubules. It will lead to increased sodium reabsorption, right? And it will lead to increased potassium excretion. Fine. Next comes, what's the question? Yeah, we'll see that. The next one, we saw about the baroreceptors. Right? We saw about the baroreceptors, the pressure receptors. There are some other receptors which are called as the low pressure receptors. Low pressure receptors. These are also baroreceptors. But what they will do, those receptors which we discussed initially, they were activated when there was stretch. These are the receptors which are activated when the pressure is low, right? So these low pressure baroreceptors, they are present into venous system. They are present into venous system, and very important, atria. Right? We'll write it in capitals, atria. And obviously, a very low pressure system, and that is pulmonary arteries. The moment we say pulmonary artery means we are now talking about the pulmonary pressure, right? So that is where these receptors will be coming into picture. So the way very actively systemic blood pressure is handled, same way even the pulmonary is also handled very beautifully. This takes us to next point, and this is one of the very interesting. It is ANP. This is what is called as the anti-natriuretic. This is one of the peptide, right? One of the peptide protein. This is anti-natriuretic peptide. Now this ANP, this is released. This is from cardiac muscles, cardiomyocytes, but of atria only, of atria. So what will they do? They will keep on checking that if the blood pressure is less, they will lead to vasodilation. So there is a control over there also. Another special thing about the ANP is that if it is released, it will go all the way to the brain. Right? It will also, yeah, that's right. It's also called ANP. It will also go to brain. And in brain, it will inhibit ADH, antidiuretic hormone. So that vasopressin, because its function was vasopressin, right? So that vasopress, so that is stopped. So this is ANP. Good to know, right, that it will lead to vasodilation. Another thing, this is a vasodilator, right? It is a vasodilator. Vasodilator means this is doing what? This is lowering the blood pressure, correct? It is lowering the blood pressure because it is going for vasodilation. It is also inhibiting antidiuretic hormone. Antidiuretic hormone was not letting the water go. Now it is telling let the water go, because when the water will go, that means pressure, the plasma volume will decrease, the blood pressure will come up, right? So if the blood pressure is decreased, so it inhibits antidiuretic hormone. It leads to vasodilation. And the third very interesting thing is it will be acting on kidneys. Same area, distal convoluted kidney and the collecting ducts. And what it will do, must have guessed, increased sodium excretion. So when there is increased sodium excretion, that antidiuretic hormone is not there. Antidiuretic hormone is not there, so apoporin V2 channels, they are closed. So there is no one who is telling the water to come back, and water is following sodium. So water and sodium, they will go away. Thus, the plasma volume would be reduced, right? And when the plasma volume is reduced, so there will be relatively increase in the blood pressure, and the life is good. So this is how all the systems, the entire blood pressure is regulated, which is a combination of multiple factors. All right. Next time, so when there is increase in the blood pressure, so that is what is called as the hypertension. Hypertension. And this hypertension, it is divided into two parts. One, what is called as the primary hypertension. It is also called as the essential hypertension. Essential. We'll be talking about both the hypertension, that is systolic and the diastolic. And diastolic is always more dangerous. So primary and the secondary hypertension. So we'll talk about both of them. All right. So that's it for today. Thank you so much. Wish you a very happy weekend. Enjoy and stay fit and healthy. One thing. Durgesh, want to ask anything? Go ahead. Carrying a gold Ganesh item to Russia. How much is the weight? Because beyond certain, it would be difficult. No, there is. If it is gold plated, so you can, for the safety, none of the ornaments, right? It is a rule that whenever you are traveling, whether it is domestic or international, any of the ornaments should never be kept. Ornaments and cash should never ever be kept into the luggage. It has to be into your hand luggage. So keep it with you. Gold plated, then it is fine. All right. Okay, so take care. That is allowed. If it is small, nothing. It's completely fine. You need to talk to the administration. You need to talk to the administration. So if the classes have started and if you have taken the admission, then you must be into the loop, right? They will definitely be telling if it has started. All right. Thank you so much and see you soon.